King Charles III's health crisis has forced Prince William and Princess into a devastating public revelation that changes everything for the British monarchy right now. In a moment heavy with unspoken fears and visible strain, the future king and his steadfast aunt stood before the world to address the deepening concern surrounding the sovereign condition, delivering words that carried both gravity and quiet resolve. This announcement did not emerge from sudden collapse but from the accumulated pressures of an extended health battle that has quietly reshaped daily life inside royal residences. It highlighted the delicate interplay between medical necessities, familial loyalty, and the constitutional machinery that must continue functioning without pause, offering a rare window into the human realities behind the crown's enduring facade. Royal watchers had noted subtle shifts in schedules and increased involvement from senior members for some time, yet the joint appearance crystallized the seriousness of the situation. King Charles III, who first shared his cancer diagnosis in February 2024 after procedure for an enlarged prostate revealed a separate issue, has approached treatment with determination and openness. Medical teams acted promptly, and the monarch has since balanced ongoing care with public duties. But the journey has required careful pacing and support from those closest to him. Accounts from seasoned royal correspondents, including detailed examinations in Robert Hardman's Charles III, New King, New Court. The inside story illustrate how such periods test institutional resilience while revealing personal strengths within the family. Princess Anne, renowned for her decades of tireless commitment and unflappable demeanor, provided a pillar of stability beside Prince William. Her role has expanded naturally, encompassing oversight of household operations and additional ceremonial responsibilities to ease burdens elsewhere. William, who has candidly described the past couple of years as among the most difficult in his life amid health challenges affecting both his father and his wife, the Princess of Wales, now finds himself at the forefront of many high-profile engagements. Their united presence served as a message of continuity and collective strength, reassuring the public that the monarchy remains steadfast even as private adjustments unfold behind palace doors. Tracing the established timeline reveals a story of proactive medical intervention and gradual adaptation. The initial diagnosis prompted postponement of some public-facing activities, yet Charles soon resumed select commitments, including hospital visits where he connected deeply with patients and staff. In a heartfelt pre-recorded message for the Stand Up to Cancer campaign, he emphasized the life-saving impact of early detection, announcing that his treatment schedule will be reduced in 2026 due to encouraging progress. This milestone allowed him to maintain activity levels, from engaging with wildlife at London Zoo to participating in Holyrood Week events in Scotland, demonstrating remarkable energy despite the underlying condition. The emotional layers of this experience extend throughout the family. Queen Camilla has offered unwavering companionship, remaining by the king's side during rehabilitation phases. The Princess of Wales, having completed her own successful cancer treatment and remission journey, has resumed duties with renewed focus, including joint appearances with William to support NHS efforts. Their children, Prince George, Princess Charlotte, and Prince Louis, receive age-appropriate explanations that prioritize family unity, as William has stressed the importance of being present during uncertain times. These private dynamics inform the public poise displayed in announcements and engagements. Historical context enriches understanding of the current moment. Clifford Brewer's The Death of Kings, a medical history of the kings and queens of England analyzes how sovereign health has influenced reigns for centuries, from medieval monarchs to modern times. Charles' emphasis on transparency marks a contemporary evolution, fostering public empathy and awareness campaigns that encourage screenings worldwide. His personal reflections on treatment side effects, such as a challenging metallic taste of chemotherapy shared during a visit to Guy's Cancer Center, humanize the experience and build connections with others facing similar battles. Public response to the announcement blended concern with expressions of solidarity, bouquets left at Windsor gates, supportive messages from across Britain and the Commonwealth, and thoughtful commentary from outlets highlighting the monarchy's adaptability. Royal editor Roy Nicker has observed the king's continued good form in recent interactions, underscoring his dedication even while managing health protocols. This period prompted broader reflections on duty, where personal well-being intersects with national expectations, leading to streamlined schedules that prioritize sustainability without diminishing core functions. Robert Jobson's insightful biography Our King. Charles III, The Man and the Monarch revealed portrays the sovereign as a figure driven by profound convictions on environmental issues, architecture, and philanthropy. These passions persist, albeit in moderated form, as health considerations guide pacing. Prince William advances a complementary vision through initiatives like the Oathshot Prize, focusing on innovative solutions to climate challenges and efforts addressing homelessness and mental health. Such work positions him as a forward-looking steward while honoring his father's legacy of thoughtful intervention. Catherine Myers Charles, the heart of a king delves into the monarch's complex inner world, blending activism with a deep sense of constitutional responsibility. Health challenges amplify these traits, revealing how vulnerability can coexist with leadership. Princess and Practical Wisdom, forged through extensive service including equestrian and military affiliations, aids in navigating these complexities, ensuring operational smoothness across royal households. Further adaptations include refined access protocols for private wings, ongoing medical support teams, and collaborative distribution of duties among working royals such as the Duke and Duchess of Edinburgh. Constitutional briefings continue flowing to the king, preserving his role as head of state, while William handles increased diplomatic and public-facing responsibilities. This model reflects a modern, supportive framework designed for longevity rather than rigid tradition alone. The announcement's tone remained measured and forward-looking, avoiding alarm while acknowledging necessary changes. It underscored gratitude toward medical professionals whose expertise has enabled positive steps, including the scaling back of intensive treatment phases. Charles' recorded messages often highlight advances in cancer care, offering encouragement to the millions affected globally and positioning his experience as a catalyst for awareness. Public broadcasters and newspapers captured the national mood through images of well-wishers and analyses emphasizing unity over uncertainty. Within Kensington Palace and Clarence House, daily rhythms adjust to accommodate recovery alongside service. William balances fatherhood, charitable work, and heir responsibilities with evident care, as seen in his polo appearances for charity and community visits. Catherine's return to activities like endurance challenges inspires many, symbolizing hope and holistic wellness. The family's emphasis on normalcy for the younger generation provides grounding amid heightened public scrutiny. This health narrative ultimately celebrates resilience forged through openness. By confronting challenges collectively, the royal family models strength that resonates with audiences facing their own trials. Fans worldwide draw inspiration from a blend of tradition and humanity, recognizing that true endurance comes not from concealing weakness but from embracing support and adaptation. As schedules evolve and roles shift, the core mission of service persists, binding the monarchy to the people it represents. Looking ahead, the focus remains on sustained progress and shared purpose. Charles continues contributing counsel where appropriate, his voice informed by lived experience and long-held values. William and collaborative efforts ensure seamless transitions, safeguarding stability for future generations. The announcement, though sobering, reaffirms the institution's capacity to evolve while honoring its foundational principles of duty, empathy, and continuity. In this light, the monarchy stands not diminished but deepened by the trials it navigates together.